last night the White House issued various executive orders. Some of them dealt with a federal hiring freeze, a freeze on regulations, and other issues. We're still reviewing them in my office. The issue of a workforce hiring freeze memorandum claims that it will not, quote, adversely impact the provision of Social Security, Medicare, or veterans benefits, end quote. I'd like to know from you, what does that mean in practical terms about the employees who deliver veterans health care or work in cemeteries? Does this language exempt all of the VA's positions from a hiring freeze?
I think, Senator, we're still like you examining that, but we support the president's initiative here in the freeze. But also, I take, as far as what it says, I'll take it at the words that's on the paper, and that's not going to affect it because we have people doing those benefits packages right now. We have people working at that. And the implication would be that adding more people would fix whatever the problem is. I'm convinced right now that the workers and the benefits, we need to make better efficiencies with what we currently have. So I support that.
Yeah, that's not reassuring to me because I'm asking not about the VA employees who work on benefits. I'm asking about the folks who are in the hospitals, in the care facilities, at the cemeteries. They're not dispersing benefits, they're providing care. And as you well know, there are extraordinary problems in recruiting and retaining the doctors, the nurses, and filling their ranks where there are openings right now. So the explicit language of that memorandum seems to include them in the hiring freeze.
Going by the way you have worded, I will say this: so hiring freeze in the wording that you use, and I do not have this before me, so I'm not going to comment completely on it. I do not have it in front of me. I'm going off of the memory, and we're still examining that as well. I can assure you President Trump is in this executive order is to get assessment on where we are with our employees. It is not to take away from anything that is currently there in future. And the way that your question is worded is implying that they would not be there to do the veterans health care, the cemetery work. That's going to continue. This new hire freeze is not there. We may not at this point bring in a new person tomorrow unless we need it, but this is where we're at. And I think what he's done is to get an assessment on where we are.
Well, you and I are trading a lot of words. Let me come right to the point. I'm asking you to fight to fill the openings, not a hiring freeze, in the ranks of the doctors, the nurses, the attendants, everybody who works in care facilities or in veteran cemeteries, rather than leaving those positions open because those folks are needed to care for veterans. Will you seek an exemption to the hiring freeze for those positions that concern veterans care, including the Veterans Crisis Line?
I will take everything that you've said into consideration and understand that the freeze and export the executive order, while at the same time, if confirmed, be willing to make sure that there's nothing missing in the process. We may, as you said, we're sharing words. I think we're saying the same thing.
Well, no, we're not. With all due respect.
I respect that.
This is going to be a first test of your leadership. Whether you fight for an exemption in the hiring freeze for the non-veterans benefits employees who are needed to care for veterans at medical facilities and other places, including the Veterans Crisis Line, rather than have them covered by that hiring freeze.
Senator, I view this as not as a test of what I will do. I believe it is a test of two different assumptions and assuming that just because there's opening that there's an actual need at that point that makes a veteran miss their benefits of health care. I think we're coming at it from two separate perspectives. There may be openings, but there was openings yesterday. There was openings last week. This is simply looking at ahead to say where we're at this point. I think we're coming at this as two separate perspectives. I respect yours greatly. But I think what we're going to see is no one on the veteran health care side is going to miss their health care provider because of this new hire freeze. The president is doing a prudent step as he comes into office to make sure that we have a good handle on what we've got and going forward. I will always fight, Senator, and I've told you this in your office and I'll tell you again here, for what we need at our facilities. But I'm also not going to fight for issues in which I believe that I've not had a chance to study and make sure that this issue is taken care of. I do not believe this is going to have the impact that you're having because I think we're coming at it from two different perspectives.
Well, I will just say, I don't want to get into an argument here, but there are possible openings where, let's say, the head of the West Haven VA facility says, oh, well, we don't need to fill that position.
Yeah.
But there are also openings where the director of the facility is saying, we need more nurses.
Yeah.
We need more doctors. We need more mental health care. You and I have talked about this issue. You can't provide veterans health care without the people, the skilled professionals to do it.
I appreciate it.
And I hear you saying if there's an opening, it means that we don't need somebody for that opening.
No, I think, Senator, just a general reminder, last week, Secretary McDonough could have filled those positions. He chose not to, or couldn't find anybody.
Well, he may have wanted to, and you may have talked to him about it, but it's not easy to fill those positions.
And Senator,
They've
that's
worked
why we're
hard to
taking a
fill.
perspective of where we're at. And again, I appreciate it. We'll work on this together, but I respect what the president's done. I think it's a prudent step looking forward, and that the health care is not going to be compromised in that process. I support that.